Compassionate Care, Teresa speaking.
Hospice care is for patients who are terminally ill with a prognosis of less than 6 months to live. We have a patient, Victoria Lamone, who is on our Cardiac Connections program. It's our heart failure program, which is a program designed for hospice patients.
She's been suffering from heart disease for quite some time. She retired on disability, but her condition really started to deteriorate about 3 years ago. It became harder to take care of her myself and work. I talked to Dr. Haas, her cardiologist. He had told us about hospice, and he said, you know, Judy, it's probably time, and they can help you.
That's when Dr. Haas had a conversation with Victoria and with Judy and said, you know, I think there's a different approach we can take. There's something better that we can offer for you. There's this program that we can offer you where we can keep you at home and we can control your symptoms and keep you out of the hospital.
The hospice care has had a very positive impact on our lives. She's at home, surrounded by the people that love her. There's somebody to call 24 hours a day, 7 days a week if there's a problem. We're partners in caring for my mother now.
Nurses that I've trained see Vicki twice a week, and then a home health aide helps with all of Vicki's private needs, personal care needs.
We actually can spend quality time together. And from my mother's perspective, she doesn't have to feel like she's a burden or I'm always, the one having to care for her. I'm an only child. My father's been dead for quite some time. I was never married. And then in the midst of everything, I met John. Our first date, I came home and I said to my mother, I met the man I'm going to marry. And that's quite a statement at 52.
Victoria has a goal on what would make her comfortable, and Judy had a goal. And her goal was to get her mother to her wedding. And one of our staff members actually went out with Victoria and accompanied her to the wedding. So they had somebody there with her, and Judy could take her vows with her new husband and feel like Victoria was well cared for.
Hi, Vicki. How are you feeling?
Okay.
Liz Lillo, the nurse practitioner with Compassionate Care Hospice, Cardiac Connections, who had originally signed us up, when she signed us up, said she would come to the wedding. I told her I would absolutely invite her to the wedding. She would be our guest. And she says, no, I'm going to come to the wedding. I'm going to take care of your mother. She'll be my date. I never in my life did I think that I would, first of all, get married and she would be there to see me. I just didn't think it was going to happen. And she didn't either. So it was joyous, without a doubt.
When we think of hospice care, we think of patients whose life expectancy is measured in days. And that is something that the general public thinks of a lot. And that is very often the case. The real benefit comes when we're able to be connected up with patients and families much earlier, where we are able to work with them weeks to months as opposed to days to weeks.
When she has a good day, it's not the doctors we want to go to. We go get a manicure and a pedicure. That's a nice picture. So here we are. And my mother's been on the hospice program, I think, for about 5 or 6 months now. What was it like for you to be there?
Oh, God, I couldn't have been happier. It was...
Me either.
It was my dream come true.
I know. No tears.